You have pain after you eat, and it's often crampy pain that occurs usually on the right side, but not always, sometimes kind of in the middle of the belly. And it'll be crampy for maybe half an hour or so and then get better is kind of the typical presentation. Gallbladder disease is the textbook answer. The most common is that it occurs in females, and there's nothing that you can do if you're a female to make yourself not female. It occurs in patients who have had children before, particularly. I think the one thing that you might be able to do to limit gallbladder disease is to limit the fat intake and limit the fried foods and that kind of thing. But we also see gallbladder disease in slim, young 29-year-olds, and so I don't know that there's a lot you can do to avoid that. It used to be a very major surgery that would keep people in the hospital for a week at a time, and they'd have a cut this big, and it was a very painful cut. And I think in the late 80s they switched to doing it laparoscopically, and now that's the standard of care, and that's how we all do that. A lot of times people can go home the same day, if not the next day, as long as they're able to eat and drink. They're probably going to be taking pain medicine for maybe a week or two, and after that, since it's done laparoscopically, there's no big major cuts to heal, and so most people are able to go back to work within 2 weeks.